Hi, I'm Dr. Julie Steinauer, and a lot of times we get asked the question, well, how young is too young for vision therapy or syntonics? And I want to answer that one, but first let me tell you how to connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and either click on the schedule a consultation button or fill out a questionnaire. Now, how young is too young? Well, there's not a too young. Most of the time, we're going to have patients that connect with us, or their parents will connect with us about the age of 6 months. The reason why is that usually we tend to see that the vision system is a little bit more set with binocularity by 6 months. So if we're seeing the eyes are turning at month 1, that's not really a real big worry or concern. You have to think that your baby has been inside of your body for 9 months, and they've dealt with light differently. They've dealt with things that they see completely different. Once they come out to the outside world, those eyes have to figure out how to adjust, focus, handle light differently, handle images and objects and your face and everything. So their two little eyes might not work together perfectly in the very beginning, and it's fairly normal for the first few months that might be going on. After a couple of months, though, is when we expect to start seeing the eyes coming into alignment, lining up and working together as a team, and then being able to really focus on things. Clearly, if they're not focusing on things, like you don't even get them to pay attention to a toy, you don't get them to look in your face, they're always looking off the side, they're showing no interest in holding any kind of fixation or looking, those are things that are really, really concerning in babies. So you definitely want to, not just kind of sit around and wait if you're not seeing them, just, if they're not paying any attention to something, or they're showing no interest. They're showing no interest to move or scoot or interact with their environment in any way. Those are all alarming and concerning things. So what age can we start seeing your young, baby? Well, probably within about 5 to 6 months. Sooner if you're concerned, obviously, but for the most part, around 5 months or so. 4 months maybe a little bit, a little bit early, but that's okay too. There's no problems with us seeing your 4-month-old. But again, around about 5 to 6 months, you're starting to see some things become a bit more solidified. Obviously, around 1 year, a lot of things are becoming a bit more solidified. So if you feel like your 12-month-old is maybe behind schedule visually, they're still not paying that much attention, they don't have an active interest in playing with toys too much. And again, maybe they're having a difficult time making eye contact or looking you in the face. They're always looking off to the side. Those are signs of things that are really concerning, and we need to be looking at your child at that phase if you're noticing them. Obviously, beyond that, if they're a little bit older, definitely don't ignore those types of things. If you feel like, boy, there's just not good fixation, they just don't really want to look at people when they talk, it's just still are not showing a big active interest in moving around, or maybe behind in crawling or walking or any of those things. Those are definitely times to have your child looked at, because there can be so many things that could cause them to be visually, developmentally delayed, and we want to get on top of those things right away. Let's just say that you notice that their eyes are moving. So a movement pattern would be that the eyes, not just a normal tracking and moving pattern, but something like the eyes wiggling like this. That's a condition potentially called nystagmus, in which the eyes kind of wiggle or move and they don't stay stationary very well. Particularly if kids look off to one side, you might notice it at an angle a little bit more, like looking ahead they're okay, or looking off to the left they're okay, but gosh, when they look off to the right or when they look up, you see some sort of a movement more. So nystagmus is another condition that's something, that needs to be looked at right away. We need to be able to diagnose those things and then come up with an action plan of things that we can do to help your child. And, can we do things at those young ages? Absolutely. It may just involve the syntonics or photo light therapy, which we talk about on here all the time, but there are things that are obviously easy for us to be able to do with your child. Again, the syntonics might be, we may have you do certain things like coordinating their body in specific patterns that could help them with, improving their ability to start crawling or walking. We may have you do things with their arms, moving their arms and their legs. We call it a surrogate method if you do it for them because they're not able. But you can start doing certain things with your child in a specific pattern based on what's going on with them visually. It's really important that can help them to develop a little bit better. So don't hesitate to reach out to our clinic if you've got someone really little in your life and you're concerned about how their vision is, seeming to be performing for them. If they're just not making eye contact, they're really not wanting to look you in the face or look you in the eyes. Again, they're not showing a lot of active interest in playing with toys. Maybe they just want to lay there and just kind of be like a lump, and you're wondering, good grief, why on earth are they just not that active? These are all things that are alarming. Please feel free to reach out to us. You can call us at 618-288-1489. You can go to our website at visionforlifeworks.com, and two things can happen there. You can either fill out a questionnaire or you can click on the schedule consultation. There's a button that you can click on. If you do schedule a consultation with me, I will want to make sure that I see your infant, or if we're seeing them in the clinic. Obviously, they're going to be coming into the clinic to see us, but I will want to see them if we're doing a consultation video for at least a couple of minutes so I can see what's happening with them, how attentive they are visually. I'll have you do some things with some toys and watch certain skill sets during that consultation time that will give me a clue as to whether or not they are developmentally delayed and what we need to do. We don't want your child just kind of laying around like a bump or a lump. We want them doing things. They should be active, and certainly they should be active after a couple of months, but you should see them being active, really right away and engaging and trying to look at your face. Hopefully during the entire pregnancy they've heard from you, Mom. Hopefully during the entire pregnancy they've heard from you, Dad, so they understand your voice and hear it. So you should be seeing them turn towards you to look at you and those sorts of things. And if you're not seeing that and you're seeing like there seems to be a lot of real delays here, please do not hesitate to reach out. We want to give your child the best of, possible ability to catch up if they need to catch up, develop if they need to develop, but to also be appropriately performing like at age level with certain visual skills. So reach out to us again if you like this video. We'd love it if you like it, and subscribe to our YouTube channel if you've not. Click that bell icon for all videos so you don't miss anything. And obviously if you know someone that you're concerned about, maybe it's a neighbor, maybe it's a cousin, maybe it's a friend's child that you've seen and you're like, boy, they're just not really behaving like you'd expect to see for an infant, please pass this along. It's really important because their development for many, many things can be affected by having poor visual skill, or if there's any kind of neurological, delay. That's something that we could work on that would help them to develop and be able to be more age appropriate in how they interact with the world. It's super important, and you can play a part in that. Thank you.